Case 32. A mother of a 1-week-year-old girl calls her pediatrician because the infant has been fussy all morning. The infant's temperature is 39 degrees centigrade or 102.2 degrees Fahrenheit, and the mother is asked to bring the infant to the hospital for further workup and treatment. The workup includes cerebrospinal fluid analysis, hematology studies, and cultures. Empiric antibiotic therapy is initiated. Later, upon microscopic examination of the CSF, microorganisms with tumbling end-over-end motility are visualized. What is the most likely diagnosis? Meningitis due to Listeria monocytogenes infection. This microorganism, identifiable by its classical tumbling motility, is a gram-positive rod and a common cause of meningitis in newborns and the elderly. So I'm looking at table 3-2, which shows the age group preference of most common infectious agents causing meningitis. So for Streptococcus pneumoniae, this affects infants or children, teenagers or adults, and the elderly, but not newborns. Neisseria meningitis is affecting infants or children, teen or adults only, but not newborns or elderly. Enterovirus affects infants or children or teens and adults, but not elderly or newborns. Escherichia coli, which is a gram-negative rod, affects newborns or elderly. Listeria affects newborns and elderly. Group B, Streptococcus, affects newborns only. How is the pathogen in this condition transmitted? L. monocytogenes is transmitted through ingestion of unpasteurized dairy products such as milk, cheese, and ice cream. What microorganisms should empiric antibiotic therapy target? Group B Streptococcus, Escherichia coli, and L. monocytogenes are the most common causes of sepsis and bacterial meningitis in infants younger than 1 month of age. Therefore, empiric therapy should be aminopenicillin or vancomycin for gram-positive infection, and aminoglycosides, anti-pseudonormal penicillins, or 3rd or 4th generation cephalosporins for gram-negative infection. How does this microorganism evade the host immune response? L. monocytogenes is a facultative intracellular bacterium able to survive in the macrophages of neonates and immunosuppressed patients. In an immunocompetent host, activation of macrophages destroys phagocytosed Listeria. What other population is at a particular risk for developing the same infection? Pregnant patients are at increased risk of developing a serious illness from Listeria known as granulomatosis infantisepticemia, known as granulomatosis infantiseptica. It can cause various complications to the mother and baby, from premature rupture of membranes and intrauterine fetal demise. The elderly and immunocompromised are also at increased risk for this infection.